Changes could come to BC's decriminalization pilot, with the province requesting the recriminalization of public drug use. In 2022, the province was granted an exemption from the Controlled Drugs and Substances Act, allowing people in the province to legally possess small amounts of certain illicit drugs. But the program has faced backlash, mostly over public safety. And last Friday, Premier David Eby requested changes to the program.
We today have made a formal request to Health Canada to amend the exemption to the Controlled Drugs and Substances Act, which will give the police the tools they need to enforce the law anytime someone is using drugs in an inappropriate location and compromising public safety. In short, this amendment will make public drug use illegal in British Columbia.
Premier David Eby said these measures will address public safety concerns, and the amendment is for the public use of drugs. Meanwhile, the use and possession of illicit drugs in private remains legal. The Premier said they are working to get the balance of public safety and curbing drug deaths right. The decriminalization pilot started in 2023 as part of the province's response to the ongoing toxic drug crisis, which was declared a public health emergency in 2016. The program was intended as a way to address drug poisoning as a medical issue instead of a criminal one. It allowed for the legal possession of up to 2.5 grams of some hard drugs. But the program has faced growing criticism, with some calling it a failed experiment. City News took to the streets to see what Vancouverites think about the issue and if they were for or against decriminalization.
A part of them aren't criminals, they're just addicts. But another part is that there isn't a firm hand coming down on it, which encourages it more and doesn't necessarily deter it from happening. So it's a bit of a catch-22. I don't think anyone's got the right answer just yet.
All drugs should be legal.
Think so?
Yeah, okay. And patent safe supply is maybe the only solution, or perhaps income equity for everybody.
It's like drinking, smoking, smoking pot. I think when people have their own, regulate themselves, or if they have a problem, there should be places you can go to get help for it, like anything, but we don't do that down as well.
Well, I lived here in BC for 10 years almost, and the situation got worse. But I think there's just more people coming in. I don't think it has to do with the decriminalization or decriminalization of drugs. I think it's just the availability of them in general.
I think in other places they've proven that it was an experiment that didn't work out well. And I think a lot of people have been damaged, a lot of homeless people, and I don't think enough is being done to solve the problem.
The BC government recently made changes to its drug decriminalization pilot, a program that has been controversial from the start. Joining us is DJ Larkin with the Canadian Drug Policy Coalition. Larkin is here to talk about those changes. So thanks so much for joining us here today. A lot has happened in the last week, but I want to start talking about the pilot project. So what was the original goal of this pilot?
The goal of decriminalization as a policy is to remove that policing element and the risk of incarceration for simple drug possession. And the reason for that is because policing and the criminal law really does impact people who are experiencing poverty and homelessness, people who need access to health services but may not be able to go to them for fear of arrest. It stops people from calling 911 in case of emergency. And so decriminalization is an essential policy piece to help people access those services and to decrease the rate of incarceration, because we know that that increases homelessness and harm. But decriminalization alone will not get us out of the health crisis.
And I guess I'm going to jump ahead a little bit, but in terms of that, it's not banned in private spaces. So where's the balance?
Yes. So the changes to the BC policy to recriminalize drug possession or drug use, we'll have to see what the actual amendment looks like. In public spaces essentially means that this policy will not be able to benefit people who are deeply at risk. The reality is, the only thing we know in life is that you have to put your body somewhere all the time. For many people in this province, they do not have a home to go to, and we lack the services for people. So people rely on public spaces because they are essential for them and because they might be the safest place for them to be. And they will no longer have the benefit of this pilot, and again will risk being incarcerated, criminalized, and put at greater risk of fatal overdose.
In terms of the goal of the pilot, do you think the province succeeded with what they were trying to accomplish?
I would say in part. So we did see a dramatic decrease in the number of offenses for simple possession, which is part of the goal. And when you start to see trends like increased access to drug checking services or overdose prevention sites, that is always a good thing. Where we didn't succeed was that this needed to come with a public education campaign to help people understand this policy, to combat misinformation, and to make sure that there's public support for it. This is a conceptual change, and those changes only work if people understand them.
That makes a lot of sense. And the province with banning, you touched on it a little bit, with banning drug use in public spaces, what other impact does that have?
It really means that people will once again be targeted. It means that if you see someone who is perhaps without housing, visibly poor, is acting in a way that you don't recognize because you don't live the same life as them, there will be an inclination to call police, to treat people as not members of our communities, to reintroduce that element of policing and displacement. And ultimately, the evidence demonstrates for decades when people fear police or incarceration or isolation, they will go further afield to avoid that type of stigma, to avoid those interactions, and that means people are more likely to be using in isolation, alone, and we're going back to those days, even before Insight, when people were dying in alleys.
And you mentioned evidence. The coalition's stance is evidence over ideology. So what else does the evidence support?
Certainly. I mean, as a coalition, we are a group of people who spend every day scouring data, academic literature, policy reports, and the evidence is overwhelming. Decriminalization is an essential path forward. It can reduce the harm significantly of people at risk of overdose, and it doesn't solve the unregulated nature of the drug supply. We need to move folks away from the unregulated drug supply and to provide a spectrum of services for folks in terms of treatment and care that are voluntary, evidence-based, and available on demand. The evidence is unassailable in that regard. Going back to criminalization is tempting because our brains want a simple answer. But a one-year pilot project did not get us into this problem. There is public drug use all across the country and the world. A century of broken policy got us into this, and we need to take more progressive steps in order to get out of it.
And many people are saying that the recriminalization will lead to more toxic drug deaths. What else can you tell me about that? Do you agree?
It is a deep fear that it will. Again, because people will not only be at risk of being policed, but because of the rhetoric and misunderstanding, and I'll say the sort of political theater that has been going on, that actually increases the risk that members of the public will be calling police more often. That means people will hide. When someone needs naloxone, when someone needs oxygen, you only have minutes. So for a nurse, an outreach worker, an EMT, if you can't find that person, they're not going to make it.
Yep, those minutes definitely matter, seconds even. So Petra Schultz with Moms Stop the Harm has released a statement saying it's infuriating to see the deaths of loved ones being politicized. Do you agree that there is a kind of political football match going on instead of actually focusing on the people?
I would say certainly. We've seen this dramatic rise in political rhetoric, and so even with this BC policy of backtracking on the decriminalization pilot, that's really about trying to regain political popularity. It's the wrong path, though. The way to actually move forward and build that confidence is to do good public education about decriminalization and to provide the services that people need. But what we are seeing is misinformation to hopefully make people feel fear, because when people feel fear, they will vote. And that is so dangerous. 7 people in BC on average die a day, about 22 across the country. So when Petra says stop playing political football with our families, those are real lives today, right now, that she is talking about. And so we need to take a step back and say, how are we going to build a compassionate and caring and healthy community together, because we are all in community.
And to give it a little more context and scope, you said that those deaths actually equate to the size of Yukon.
So in BC, we declared a public health emergency in 2016, and if you look at the federal data starting in 2016, over the 7.5 years between then and mid-2023, over 42,000 people passed away from a preventable death. That is approximately the population of the entire Yukon.
That is absolutely mind-blowing to hear that. So where, aside from, you're saying there needs to be more of a kind of public awareness campaign to combat misinformation, but where else does the province need to go from here?
Certainly, the province needs to follow the direction of experts like the death review panel of the coroner's office and the coroner's office itself, which has called for more action to separate people from the unregulated drug supply. One of the reasons that people are seeing folks in the streets who might seem sedated or look like they're struggling is because we're seeing more contaminants in the supply, tranquilizers being mixed in, so people become quite sedated, and it can be quite dangerous because it doesn't respond to naloxone. We need to find alternatives to the unregulated supply quickly. That can be done through compassion clubs, that can be done through prescriptions. The second thing the province could do immediately is open more overdose prevention sites. There's been a ministerial order in place since 2016 to open overdose prevention sites anywhere they are needed, and it has never been implemented.
Such a complex issue. Thank you so much for joining us today, DJ. That was DJ Larkin with the Canadian Drug Policy Coalition on BC's plan to ban the public use of drugs. The decriminalization pilot is a polarizing subject for many in British Columbia. City News will continue to bring you discussions delving into different sides of the issue. What are your thoughts on the drug crisis, and how should the government be addressing it? You can email us at vancouver@citynews.ca. Stick around for more news coming your way.